From the Central Western Washington area, Choice Regional Health Network presents the Equity Circle podcast, a place for information with integrity, accountability, and innovation. Enjoy the episode. All right, everyone. Welcome to the Equity Circle podcast. My name is Lawrence Kinnaman, and I am your host. Today, I am joined by Katie Madinger from the Olympia Free Clinic. Welcome, Katie.
Hi, Lawrence. Thanks. Thank you for having me.
Of course. So, Katie, why don't you just tell us a little bit about yourself and what the Free Clinic does and anything else that you'd like to share?
Yeah. So I'm the executive director of the Olympia Free Clinic. We are a nonprofit organization. Our mission is to provide healthcare services to underserved community members. Our mission statement speaks to underinsured and uninsured adults, but really what that looks like is any adult community member who has a barrier to accessing mainstream healthcare services.
That's awesome. How long have you guys been going for?
Yeah, the clinic. So it's a second iteration. There was a first free clinic back in Lacey in kind of the mid 2000s. That one closed down, and this one restarted in 2010. Saw its first patient in May of 2011.
So about 10 years now that you guys have been going?
10 years.
Awesome.
Yeah.
And so when you say underserved or underprivileged communities, can you talk maybe more specifically about what those communities look like and what that work does for you guys?
Yeah, absolutely. So originally, the idea was that insurance was a major barrier to people being able to access healthcare. So not being able to have insurance kept people from going to the doctor. And then over the years, that idea has expanded. So understanding that insurance isn't the only barrier, that maybe you're fully insured, but financial concerns are a barrier, right? You still can't afford your deductibles or your co-pays. And that idea, again, has expanded in the last few years to recognize that in addition to that, there are barriers like organization. So being able to make or keep an appointment, or transportation, being able to get to an appointment. These things are all barriers for people being able to get to healthcare. So that's what we do. We try to identify those barriers and do our best to kind of break them down and get people connected to medical care.
Yeah, absolutely. So today, one of the things that I wanted to talk about was the COVID vaccine and what that has looked like for you guys and the communities that you serve. And so I'd be curious if you could just tell me more about that. And before we get into that, I would love to hear if you are vaccinated. And if you are, why did you choose to get vaccinated?
I am vaccinated. I got vaccinated as soon as I possibly could. And that was for a number of reasons. I think this idea that this virus can be transmitted asymptomatically, that I might get infected and then accidentally infect somebody else,
Sure.
that could get very sick or could die, that's a horrifying idea. I understood that, the more people who had some sort of immunity to the virus in the community, the less easily it could spread. So after so long of feeling kind of helpless in the face of the pandemic, like this was something I could do to try to help stop that spread.
Sure.
I hate being sick. So anything I can do to ever prevent that, I'll take that opportunity.
Sure.
And I guess the last thing is that, gosh, it just felt like such an achievement of the scientific community and the scientific process to have spent, these decades working on this technology, and then to be able to adapt it so quickly to fit this need. It was a process I really trusted in and believed in. So I felt very comfortable getting vaccinated.
So it sounds like for you that some of the biggest reasons for you were, of course, seeing how the scientific community came together to get this done. And also to protect others so you didn't transmit it or pass it on to others. And then, of course, which I totally understand, not wanting to be sick. I can relate to that. I don't think anyone likes being sick. So I can definitely understand that. So what sort of acceptance have you seen in in the communities that you serve? Have you feel like you've seen a lot of positive acceptance? Has there been any sort of hesitancy? What have you seen in terms of acceptance?
Yeah, that's a great question. It's been pretty mixed. So we have now been a vaccine provider since well, our first clinic was early March of this year. So now it's, mid-September.
Okay.
In the early days, we were doing, what we were calling mass vaccination clinics, at least for our organization scale.
Sure,
So
sure.
100 people a day. And in those early clinics, it was this joyful experience where this thing
Mm,
had become available, and these folks hadn't had access to it beforehand. It was a very different kind of atmosphere. I think as time has gone on, whoever was interested in the vaccine right off the bat, they got it as soon as they could.
sure,
And
sure.
so there has been some waning interest in the last few months. And that has definitely been a challenge, especially as now Delta is surging in our community.
What would you say are some of the obviously I know in the beginning when the vaccine was available, there was this excitement. You were talking about the celebration that happens, which I can imagine is a pretty powerful moment, waiting so long and now finally having somewhat of a solution or a powerful solution. What sort of reasons would you say people are saying, yeah, like this is why I want to get vaccinated, aside from, I've been waiting for this and now I have it. Is there any other reasons for acceptance that you've seen?
Definitely. Family was a huge one. People who had more vulnerable family members who maybe hadn't seen them in a long time. We had one person who hadn't met their grandson yet. It
Mm,
was kind of the stipulation. Their kids had said, you can't have this interaction until you get vaccinated. So being able to
mm,
give that person their vaccine so that they could, he got his vaccine and called his kids right there in that moment and said, guess what?
mm.
I'm coming to visit.
That's
So
awesome.
that was pretty amazing. Travel had been a big one.
Yeah,
Folks who were really wanting to, they've been in their home or in place for a long time and wanted to feel
yeah,
more comfortable moving around.
sure, sure.
Yeah, yeah. I think in our particular patient population, um, there's some different factors, right? Like there's lots of community living. There's some communal spaces, so
Mm,
like folks who live in shelters.
yeah, yeah.
Yeah, so there's some considerations around that as well.
So it sounds like for people, it was really a plethora of reasons, but family, and I really love the story that you shared about finally being able to see and meet that person's grandkid for the first time. That's pretty powerful. So on the flip side of that, have you seen a lot of hesitancy? You said things were kind of mixed with the community that you serve. So can you talk a little more about some of the hesitancies or things that you've seen when serving that community?
Yeah, so hesitancy has been, again, probably our major barrier to getting more folks vaccinated, because we are running, we have multiple opportunities each week to get the vaccine through our clinic.
Sure.
Um, a lack of trust in the vaccine is pretty widespread. I think there is a lot of and this isn't particular to our patient population.
Sure.
I think
Sure.
Thurston County's vaccination rates are pretty low, at least
Mm,
compared to where we hoped they'd be by this point.
sure. Sure.
Um, but the amount of information that is available about the vaccine, I think can be really overwhelming, and it is sometimes hard to parse out what's real and what's not.
Yeah. Yeah. Absolutely. So, what sort of, you talked a little bit about mistrust. What sort of mistrust, or what does that look like to be a little bit more specific?
So there are definitely, it runs the range. There are folks who think that this is a way for the government to implement some controls over them.
Mm,
Microchips get talked about.
sure.
And then there's, people who believe that this was just created too quickly for them to really feel comfortable, like
Sure.
being ready to accept it. So I think that what this situation requires is a lot more communication from the scientific community about
Yeah.
how this has been in the works for decades.
Yeah.
We should really be focusing on that messaging.
Mm. What have you seen? This is just kind of a side question. What have you seen? You talked a little about people having a difficult time, having so much vaccine information out there, misinformation, and information that really promotes the vaccine and is correct information, I should say. What have you seen or resources that people have been able to find that have been really helpful in terms of getting a better grasp and understanding of that?
Yeah, so that's a tricky question because generally we'll direct folks to the CDC, the World Health
Sure,
Organization,
sure, sure,
.gov. But for some people, they don't feel comfortable trusting in those sources. And so for us to sort of dismiss that discomfort and say, well, these are the experts, that's not a productive conversation.
sure,
So
sure.
what we're trying to do is really direct people to ask questions of our healthcare providers who are on site.
Mm, yeah,
Some of these patients have been coming to us for years and they have that trust and rapport.
yeah,
And otherwise, we're not only providing the vaccine, we're also at any of these clinics also providing kind of basic medical care to give patients that opportunity to build the trust and
yeah.
be able to ask those questions of their healthcare provider right there
Mm.
in person.
So it seems something that's really disarming is a level of trust in a relationship that's built between you and the community you serve, that, or even their own local health providers or primary care doctors have been the ones that they've trusted enough to ask those questions and kind of get more understanding. Is that correct?
Yeah, that relationship, that trusting relationship between a person and their healthcare provider, like that's key to this entire thing.
Mm,
Because that's the person who's been taking care of you for however many years. You've trusted them with
sure.
all of these other medical decisions. And so to be able to kind of get their input on this decision, whether or not to get the vaccine, is really critical.
Well, and it seems like in the interviews that we've done with other people on the podcast, there's been a lot of conversations about how powerful the word of mouth or testimony is for people who are getting vaccinated, or friends or family who may be hesitant and they're just sharing with their friends and family, like, hey, I got vaccinated, here's what happened with me, everything went fine, and I might have had a little bit of side effects, but overall, I feel much better. And so even just that word of mouth seems to be a very powerful tool in terms of people getting the vaccine or feeling like it's more safe. Would you feel like that's fair?
Absolutely. Yeah. So one of the ways that we've been structuring our clinics. So we're doing these weekly encampment clinics. Where we're actually bringing the vaccine out to the houseless community and the places where they're living. And
Mm,
one of the considerations in that clinic structure was that we would go back multiple weeks in a row. And so that would give the opportunity, maybe there's an early acceptor in the first week and they get the vaccine. And then there's a week where all their friends and neighbors get to see what the experience was like for them and then decide
sure.
whether or not they're ready in the second week or the third week. So,
Yeah.
absolutely. Yeah. Being able to have that firsthand experience is really important, I think.
So would you say then that people who have gotten to see like their friends get vaccinated, you come back a couple weeks over the next couple weeks, would you say people are like, okay, I'm ready? Has that really worked pretty well for you guys?
That has worked. We had started out to a point, we'd
Sure,
started
sure.
out doing 3-week rotations at camps, and realized that, by that third week, we were pretty saturated in terms of the folks who were ready at that time. So we've dropped that down. Now we're doing 2-week rotations.
Okay.
And what that is doing is it's giving multiple opportunities, because that's really also very important is,
Yeah.
if you're offering this to somebody in the moment and asking them to make a decision that they're not comfortable with in that same
Sure.
moment, like
Sure.
you're not going to
Sure.
have success.
Yeah.
But offering it twice and then leaving them to have some space and have more conversations and experiences, and then coming back again, rotating back
Mm,
through, that's been successful for us.
sure. Sure. Well, I would say that's pretty consistent. I've spent a little bit of time, of course, with you all going out and doing outreach, and then um, previously at a different organization working with those experiencing homelessness, and how important the level of trust is, and how important the level of consistency is before people can really start to make decisions and really follow the things that you're asking them to do or recommending them to do. So we've talked a little bit about different things that have encouraged vaccine acceptance. We talked a lot about trust. We talked about kind of word of mouth or testimonies of getting the vaccine. Are there any other things that you have seen that have really helped people say, okay, like I am ready to get it now, or I saw this happen, and I think this has helped me make my decision to get vaccinated? What have you seen that's really encouraged that acceptance?
So one of the other things we're doing is offering recovery kits as we give out the
Mm,
vaccine. These kits have, they include a sleeping bag, and they have things like water and snacks and over the counter, Tylenol, fever
mm,
reducer. So it's like things that would help people manage any side effects they might get.
sure, sure,
And so that has been, I've actually seen a couple of times, we're trying to decide how we go about sort of offering this to people because we don't necessarily, want people to feel like they have to get the vaccine to get these things that they need to meet
sure,
their basic
sure.
needs. But we have seen a few times where, somebody gets the vaccine and then we give them their recovery kit and someone else who's watching that happen, they say, "Oh, I need a sleeping bag too. I'll get the vaccine."
Mm,
So that's gone, that's gone pretty well.
yeah,
And we do feel like we've been able to strike a nice balance between, we're not withholding things that people really need for survival,
yeah,
but we are able to provide that supportive environment for getting the vaccine.
sure. So people are still getting that regardless of if they get the vaccine or not. But it does seem, from what you're saying, it sounds like it is helping people like, oh, okay, well, yeah, I'll get the vaccine too. Is that correct?
Yeah, yeah, and in some ways, it's a tricky conversation, right? Because like you
Sure,
want to like make sure you have the supplies on hand to support anyone who gets the vaccine, but like at the same time, you understand that this person doesn't have a sleeping bag and they're sleeping
sure.
in a tent and winter
Yeah.
is coming, and so you're not going to not give them something that they
Right,
need.
right. Yeah, you definitely still want to take care of them, right? That makes sense. That
Right.
makes sense. Is there any other ways of that you've seen acceptance play out, or things that you've seen that have helped?
Interestingly, I can point to something that hasn't helped that we
Okay,
had expected would.
sure, sure.
There was an outbreak in the houseless community in about the end of July.
Okay,
And what we thought would happen was that, people would get worried or nervous or see their friends getting sick and want to get the vaccine.
sure.
And that did not happen
Hmm,
enough. So, it actually, I think this is like it's an ongoing sort of social experiment to see what
sure,
works and what doesn't work. And I think it's
sure,
challenging a lot of our assumptions about people's motivations.
sure. What were there reasons or things that people shared of why they ended up saying like, no, I don't necessarily want to, despite the outbreak?
Yeah, for sure. Something we hear pretty commonly is for folks who are unsheltered houseless, that they are exposed to the elements and to
Hmm,
pathogens and things all the time, right? So that
sure,
they feel that they have a stronger immune system,
sure,
and that they don't need the vaccine to help them fight this off.
sure,
Yeah. And that's a tricky one because, like you see in some ways living outside, indoors it's a scary place with this virus, right? They're,
sure, sure,
encouraging us to take interactions outside. At the
sure.
same time, it's really hard when you get sick to take care of yourself in that environment. It like
Yeah,
wounds don't heal very well, chronic
yeah,
illnesses don't get managed very well. So
yeah,
that's a tricky conversation to have.
sure.
And when people believe something about their bodies, it's really hard to convince them otherwise. They're the
Hmm,
expert in their own person. And
sure, sure. Sure, I can see how that could be challenging. Well, Katie, I've really appreciated the opportunity to talk with you just about the community that you serve and the COVID vaccine, and I'd love if you can just share any encouragement that you would give people to why they should get vaccinated, or if there's anything else that we didn't talk about today about the Olympia Free Clinic, or anything else that you would love to talk about. Feel free to share right now.
yeah, thank you. I guess the main message I want to share is please keep asking questions of healthcare providers. I think that, you know, if you're feeling mistrustful or you're undecided, like know that your healthcare providers are there to just to help you work through those questions. And my message to healthcare providers is, gosh, I know everybody is so exhausted right now, but
Yeah.
to really resist that urge to like immediately assuage fears, by
Mm,
saying things like, oh, it's okay, science, scientific process. This is safe. This
sure.
is totally safe.
Sure. Sure.
really take the time to listen
Yeah.
and speak directly to the specific fears.
Mm.
Mm.
It sounds like the patience is key, of course, and not becoming jaded because of the. I mean, it's been a very exhausting year and a half for all of us, and especially the medical community, I can imagine. And so it sounds like from what you're saying, it's just even though that's happened and there's trauma there for sure, and it's exhausting, don't allow that to um, be taken away from patient care. Would you say that? Would you say that's a fair statement?
Yeah, I think that's really fair. And that's a big ask. Like I've definitely left these clinics and cried because I
Sure.
feel so just sort of again helpless because I feel like I have this vaccine that we waited so long for and now it feels
Sure.
like no one wants it, and
Yeah.
so it definitely I understand sort of the magnitude of what I'm asking by saying,
Mm,
take that deep breath and really listen before talking.
sure.
Mhm.
Sure. Well, that makes sense, and thank you again for being on the podcast. We've been listening to Katie Madinger from the Olympia Free Clinic, talking about her experiences with the COVID vaccine in the houseless community and the communities that she serves. So, thank you for being on the podcast today.
Yeah, thanks so much, Lawrence. I really appreciate it.
Of course, and thank you to our listeners for listening to another episode of the Equity Circle podcast. We are on all major platforms. Apple Podcasts, Spotify, and much more. Please subscribe and share with your friends and family. And remember that equity equals progress.